While the majority of Floridians voted in favor of adult use recreational marijuana, Amendment 3 did not pass because it did not get to the 60% threshold. With this, many Floridians are wondering if they qualify for medical marijuana, and if so, what it takes to get certified. So let's talk about it. Hi, everybody. I'm Dr. David Berger, a physician for 30 years, a board certified pediatrician. I'm also a medical marijuana certifier here in the state of Florida. I do certify both adults and children. My practice is www.holisticrelief, that's RELEAF, relief.com. Now, I've been told that I certified the most children than anyone in the state of Florida for medical marijuana. However, I have still certified many more adults. Now, I also do consultations for people who do not live in the state of Florida or who live far away and can't get here, but they still want to speak with me about my expertise to have a better understanding about dosing and the different types of products and routes of administration, and I'm available for that as well. Now, Amendment 3, which failed in earlier November, many people were somewhat surprised that I supported it and questioned if its passage would have hurt my business. Now, from my perspective, I have always been an advocate of legalized marijuana, but that it needed to be safe and done in a smart way. And this means making sure that a person has their products tested for things such as pesticides, heavy metals, other types of toxins, to make sure also that people are getting the same product each time that they want to go purchase it, which of course doesn't happen with the street use for either of those types of things. So I felt it was much more important to have healthy, safe products available. Now, in terms of medical marijuana in the state of Florida, this has been something that's been legal since 2016. Now, I was actually the first pediatrician and one of the first physicians overall to be certified way back then. So this has been a passion of mine for a long time, and I felt it was important to be able to help my patients out. Now, to be a qualified patient, a patient must, first of all, be a permanent or seasonal resident in Florida. They must be diagnosed with a qualifying medical condition by a qualified physician. They must be entered into the medical marijuana use registry, and they have to obtain a medical marijuana use registry identification card. Now, in terms of being a resident, at this point in time, Florida does not have reciprocity, means that if you have a medical card in a different state, it won't count here in the state of Florida. There are potentially other states that would accept our card, but it's not going back both ways, so it's not reciprocal. Now, in terms of the qualifying conditions themselves, on the original amendment back in 2016, the diagnoses were cancer, epilepsy, glaucoma, HIV/AIDS, post-traumatic stress disorder, PTSD, ALS, which is also known as Lou Gehrig's disease, Crohn's disease, Parkinson's disease, and multiple sclerosis. Now, in addition to that, there was another clause that talked about that there are medical conditions of the same kind or class or as comparable to the ones listed, which another term for this is similarly debilitating condition. And this is the way that a lot of patients actually get qualified. And so, for instance, if a patient has debilitating anxiety, a person with PTSD certainly can have debilitating anxiety, or for that matter, depression or insomnia. So a person may be suffering in a similar way, similarly debilitating condition. For that matter, people with autism can't speak, for many of them, I should say, not all of them, or have communication deficits. Same thing can be said for a person with Parkinson's disease, even though this is a very different type of condition, and it could be a different type of debilitating communication disorder, nonetheless, they can both be debilitating, which is how it qualifies. Even for attention deficit hyperactivity disorder, there is a condition known as HIV-associated neurocognitive disorder, of which the main symptoms are inattention, focus, and hyperactivity, very similar and just as debilitating as a person who has ADHD. Now, in addition to that, there is one more statement that if a person has a terminal condition, that they are allowed to be treated. Now, that has to be documented and diagnosed by a physician other than the certifying physician at the time for cannabis. Now, in terms of entering the patient into the medical marijuana use registry, so first, the doctor has to see the patient in office face to face the first time. And it has to be an MD or a DO. It cannot be a mid-level provider, such as a nurse practitioner or as a physician's assistant. Now, a physical exam has to be performed as part of that. However, follow-up recertifications, including the physical exam, can be done by video since an assessment can be made at the time, in terms of how a person's doing based upon what you're seeing. Now, also, if a patient is under the age of 18, there must be a second Florida licensed physician who states that the medical condition that the person has, that the benefits outweigh the risks for trying medical marijuana. Now, there are a couple of caveats there. First off, if a person is pregnant, they are not allowed to get medical marijuana through the system. They are allowed to access CBD, but they're not allowed to access THC. In addition, children, people under the age of 18, they are not allowed to get flower. They're not allowed to get buds, although they can get edibles, capsules, drops, tinctures, vaporized products, edibles, etc. Now, in terms of what is actually allowed here in Florida, the standard recommendation can be up to 340 milligrams combined on all of the different non-flower forms added up. But each of those individual things, like for instance, sublinguals versus edibles versus oral versus vape versus transdermal through the skin, each of them also have their own limitations listed. So they have their own plus they also can't add up to more than 340 milligrams. Also for flower, and that's per 70 days, I should say, for that, but also 2 refills are allowed or 2 reauthorizations. In addition, flower, the buds of cannabis, 2.5 ounces are allowed every 35 days, and that's also good for the entire 7 months. It's just how much can be purchased at a time. Now, there are also exemptions. So if a person, let's say they're using more of one route versus another, a physician is allowed to put an exemption if the debilitating condition that they have is not being sufficiently treated by the amount of the normal allotment. In that case, we are allowed to put in for an exemption for how much is necessary in order to treat the patient effectively. Now, in terms of the card itself, so the Office of Medical Marijuana Use has the registry. The number that is generated by the physician's office when they're first put into the system is then used for the patient to register. Now, in addition to that, there must be a photo. But if a person does have a driver's license or another Florida state ID where the photo is in the image already, then they can use that. And that's actually something that can therefore go through instantaneously most of the time. However, if there's a child who does not have a picture in this system, then one has to be uploaded into the registry, and that does bring some extra time in terms of 10 additional days. Now, in addition to that, parents or adults can be caregivers. Up to 2 caregivers can be given to a minor child who, of course, they're not the ones who are going to purchase it, transport it, or administer it. It's the responsible adult, and 2 can be done, but they have to get a caregiver card as well. Okay, so in summary, many people do qualify if they have a debilitating medical condition. For that matter, for a debilitating condition, I also look at it as, does a person have to take another medicine in order for them to significantly be able to function properly? Because if they are needing a medicine for that, then again, they're debilitated, because if not, they wouldn't be able to function. So that's another way. And interestingly, one of the most common side effects of medical cannabis is lowering of those other medicines. Now, it is, as I said, really important to work with somebody who knows what they're doing, a physician, especially if it's somebody who's treatment naive, especially if it's a child, because children are not just small adults. So if you're interested, come see us at Holistic Relief, or if you want to talk about things from a consultation perspective with an expert who knows what they're doing, please don't hesitate to reach out to us as well. Have a nice day.